What is the difference between acute and chronic rhinitis in cats? Have you ever noticed your cat sneezing or having a runny nose and wondered what might be going on? Today, we are going to discuss the differences between acute and chronic rhinitis in cats. Understanding these two conditions can help you provide better care for your furry friend. Rhinitis refers to inflammation of the nasal passages. This condition can lead to symptoms like sneezing, nasal discharge, and difficulty breathing through the nose. The main difference between acute and chronic rhinitis is how long the symptoms last and what causes them. Acute rhinitis occurs suddenly and lasts for a short time, usually just a few days to a couple of weeks. It is often caused by infections, such as viruses like feline herpes virus or calicivirus, or sometimes bacteria. When a cat has acute rhinitis, you might see them sneezing frequently, and they may have clear or slightly cloudy nasal discharge. They might also paw at their face or show mild signs of fever or lethargy. The good news is that acute rhinitis often resolves with proper care and treatment. On the other hand, chronic rhinitis is a more complex condition. It is defined as nasal inflammation that lasts longer than 30 days or keeps coming back. This type of rhinitis can be harder to diagnose and manage because it may have multiple causes. Chronic rhinitis can result from persistent infections, allergies, foreign bodies, dental issues, nasal polyps, fungal infections, or even tumors in the nasal passages. Symptoms of chronic rhinitis can be similar to those of acute rhinitis but tend to persist or recur. You might notice ongoing nasal discharge that can be clear, mucus-like, or even blood-tinged. Frequent sneezing, nasal congestion, and sometimes facial swelling are also common. Cats with chronic rhinitis may show signs of discomfort, such as pawing at their face or having noisy breathing. Diagnosing chronic rhinitis usually requires a thorough investigation. This can include taking a detailed history, performing a physical exam, and using imaging techniques like X-rays or computed tomography scans. Sometimes, a procedure called rhinoscopy, which involves looking inside the nasal passages, may be necessary. In some cases, a biopsy may be performed to rule out other causes. Managing chronic rhinitis can be more complicated. Treatment often involves long-term strategies, including medications to reduce inflammation. If a secondary bacterial infection is present, antibiotics may be needed. Antifungal medications could be prescribed if a fungal infection is diagnosed. In some cases, surgery may be required to address structural problems in the nasal passages. Chronic rhinitis can significantly impact a cat's quality of life, so ongoing veterinary care is essential. Regular checkups can help manage symptoms and prevent complications. In summary, acute rhinitis is a short-term condition usually caused by infections, while chronic rhinitis is a long-lasting issue that requires careful diagnosis and management. Knowing the difference can help you work with your veterinarian to ensure your cat receives the best care possible.